Our next speaker is a lung cancer advocate extraordinaire, and also the president of ALK Positive. So Gina Hollenbeck will be talking about online communities, support, education, and partnership in research. And I will turn it over to Gina now. Gina, the floor is yours.
Thanks so much, Ben. I'm so excited to be a part of this panel. Everyone on here has done such an incredible job for patients, and it's just incredibly warming just to hear of all of the work that's going on. And so thank you all so much for the things that you do. My name is Gina Hollenbeck, and just like Ben said, I'm the president of ALK Positive. I'm a nurse, and I was diagnosed in 2015, even though I have absolutely no risk factors. I took the opportunity to really look and see where I could find support. Oftentimes, I just felt very alone as a mother of 2 young children, never having a history of smoking. I couldn't really find in my community many people like me. So I went to the web and I started looking for people who were like me and going through the same thing that I was going through. So I found a very supportive online support group through Facebook, and about 8 of us kind of we're always on the support group and always talking to patients from all over the world. And it's been very exciting. But from that support group, we created a nonprofit so that we could truly drive research for ALK positive patients. And we've had some amazing partnerships within the lung cancer community to fundraise for research. But not only were we fundraising, we were able as patients, and I'll have to say that this disease just does not discriminate. We have doctors who get this disease and researchers who get this disease and people with PhD and biochemical engineering. And so anyway, some of these ALK Smarties got together and we were able to actually choose the research. So part of the group is fundraising for the group. Part of the group is helping choose the research. And we really were able to use some of the key opinion leaders in the ALK space to choose the most impactful research. So the first year, I've been president of ALK Positive since 2018. That year, we were able to give 3 research grants, each at $200,000 each. And they were all looking at how our immune system can really help to fight ALK positive cancer. The next year in 2019, we partnered with the GO2 Foundation for Lung Cancer, and we were able to raise $500,000 for combination therapies to combat resistance for ALK positive targeted therapies. Unfortunately, targeted therapies are amazing, and they do some really great things. We know there are side effects, so it's not like you don't have cancer or anything like that. But we do know that resistance is a really big issue when it comes to targeted therapy. So we're really looking how to combat those. And the next year in 2020, we were able to raise $1.3 million, and we funded 2 clinical trials. One was for an ALK vaccine. Another was for a combination therapy with lorlatinib. And the third was a translational research project to look at cysteine inhibitors. And so together we were able to really drive research for ALK positive. So all of that to say that when we come together as a group, we're so much more powerful and we're able to really make a difference for the disease. One, I think online communities are something that all physicians should point their patients to. Like I said, I felt very isolated and alone when I was first diagnosed. I watched the pain in my husband's eyes as I went back for my first craniotomy. And when I had my left upper lobe of my lung removed, I remember, just seeing the fear in my children's eyes and wanting to be able to reassure them. And thankfully, because I was a part of these online communities, I was really able to have hope, to see what actually could occur. Not only that, but working together to fundraise for research and to choose impactful research is another method of hope for patients, where they can really be able to feel like they can contribute to the future. So I'm a member of several ALK positive support groups. All of them are incredible. In one of them, we have right at about 3,000 members. And with that 3,000 membership, we see that people from all over the world who are ALK-positive patients or caregivers, and it's a closed group. We have some amazing administrators who really kind of search to make sure that there's no phishing in the group, and that really the patients who join the group do have ALK-positive cancer. Within the group, it's not necessarily just lung cancer. I'd say 98% of the patients are lung cancer, but we also have people who have breast cancer, sarcomas, brain cancers, and melanomas, all driven by ALK, and they're all taking some of the same targeted therapies. So we work together to share our experiences on the things that help us with the side effects and targeted therapies. I'll say that being a part of the online community has been a game changer for me. There are so many things. As a nurse, I was so excited to give advice. A lot of doctors in the community don't know that MRIs are something that we need to consider when you have a patient with a biomarker-driven cancer. There were also so many people throughout the world and even throughout the United States who just didn't get the same standard of care. So as our nonprofit, we worked together. We had a very, very generous donor create a second opinion program. So anyone who is a part of the Facebook support group can get an absolutely free second opinion from some of the leading experts in ALK-positive research. So that's one of the ways that we really felt like we could work together and really address disparities and help everyone get the same access to the best care. In addition, we noticed that particularly internationally, there isn't the same standard of care. So we kind of started this international ALK ambassador group where we were really able to take in from a survey and learn about what's going on for ALK-positive patients internationally, and working together with people from all over the world. We're really looking to improve the life expectancy and quality of life of all ALK-positive cancer patients worldwide. We've been able to bring these to light through some amazing abstracts that members have worked. I will say that this is a volunteer organization, so it's run by patients, it's run by caregivers, and it's just been one of the most amazing things being a part of this online community. But I have to say that it's not all about ALK. I look past our lung cancer community and really oncology as a whole and see that there's so much that we need to work together on as patients. I was very thankful for some very active members of other biomarker groups. Most are pan-tumor groups. And we started working together since October, so for the last 8 months, and it's called the Biomarker Collaborative. So we're really looking to make progress and for patients when it comes to biomarkers, testing and treatment, and making it really accessible and really helping some of the newly forming biomarker groups with some of the more experienced biomarker groups really learn from one another and support each other. And I find that as we come closer and closer together as a community, that the more progress that we make. And, I think Longevity and Bonnie Adario from the GoTo Foundation say it the best. And they say, when we work together, that's when we're better. And I think that patients and physicians, we need everyone working together on this monster. So, my hope is that physicians will see that these patient-led support groups, these online communities are incredibly beneficial for patients and for their care partners to make sure that we're really giving, access to people who are just like them. Another amazing thing that we're able to do within our ALK-positive support group is annually meet together in person, and we call that our ALK Summit. We have some of the best researchers coming. We also, during COVID, utilized the Zoom platform and had some Sunday night talks with ALK experts to really just be able to give our group hope and to know that things are coming down the pipeline. And I think having that information from the support group is one of the best things that can come from these online communities. It's just having hope that somebody's working on the disease. So if you're not in an academic center, if you're treated in a community hospital, sometimes that hope can be shattered if you can't find people who are just like you. So I want to just say thank you to all of the doctors on here, all of the research, the panel. Grace, you are so incredibly important. And I just want you to know that as a patient, I think I speak for the whole community when we say, thank you so much for your work, because we know without you, the world would be without us. So thank you so much.
Thank you, Gina, for that wonderful talk. It's so refreshing to get the perspective from the advocacy patient part. And I really appreciate all your words and insights into what you're doing, the money you've raised for trials. It's an incredible story and a testament to the power of the patient. I always say it takes a village, and that I think is relevant on the physician side with all the team players that are there, the physician, the nurse practitioner, but also on the patient side. You have a village that has really moved the needle forward.